Hi, everyone, and welcome back to another Med Missionary program where today we have some special guests, and they are Dr. Jade Erasmus and Suzanne van Eeden, who is a health coach. And the reason that we wanted to share about what they're doing is because they have a very amazing story about how they started working together. And the other thing is that they are coaching people through the Med Missionary protocol. And so there are a lot of people who may need more help with implementing the Med Missionary protocol. And so this is an amazing opportunity to work with a health coach as well as a physician who understand these principles and are helping people to do it. And so to do that, I just wanted to maybe introduce them and share with people how this actually started happening. Dr. Jade Erasmus and Suzanne are both from South Africa, and we actually got to meet them when we first started teaching the Med Missionary program. Dr. Jade, did you and Suzanne take Med Missionary at the same time or at different times?
I think we may have actually been in the same module. I think mine was the second time that you did the program altogether. We kind of planned to go back and look at the dates again, but I don't think either of us got around to doing that. But we think it was either the same batch or just one module apart.
Wow. Okay. And, I think I'm going to include in the description your testimony video on how you actually went from being a physician who practiced conventional standard of care medicine to learning about the Seventh-day Adventist health message and deciding that you wanted to help people heal using God's methods of healing. And then what happened when you took Med Missionary?
Well, I think there were several stages in my own learning journey. Most definitely, the Lord takes a person step by step, and it's not always everything at once. I learned things as I went along, and when I did the Med Missionary course, it was an interesting sort of additional avenue for me to realize that these remedies that God has in mind for us are not just for minor things. In many circles, I've noticed that people think that natural remedies are for the very, very minor problems, but when things get serious, you've got to go for traditional medicine. So that was probably one of the biggest things for me that I think my mind opened up to when I did the Med Missionary course, is realizing that very, very serious health conditions can be addressed in God's ways. And that kind of just steered everything else and some of the further learning that I did after that. So.
Oh, praise the Lord. And how about you, Sister Suzanne? For you, your background was that you were, interestingly enough, you were a wedding dress designer. That's just so amazing. That must be so amazing to work with such beautiful fabrics and designs and all of this. And then because of your own health issues, you became a health coach. You were learning about functional medicine and all these different things. And then you came across Med Missionary and started doing that. And I will put in the link, the interview that we did with you for yourself. How was it for you when you started taking Med Missionary, and what impact did that have?
Yeah, that was very interesting for me because I did it more as an extra to have to work with clients. And and following the protocol myself, a couple months later, I did find that there were still a few items that I was battling with. And that got resolved with the Med Missionary protocol. Yeah, so it was for me an amazing experience. Sold out.
Well, the Lord, and so I found out, of course, with Dr. Jade. I knew Dr. Jade because she was working really hard to get a lot of other South Africans to be able to take the course. And so I was familiar with her all these years as we were, working through the whole pandemic and that type of thing. Suzanne, I heard about from your sister when I went to Ireland and did a missionary program there. And I didn't know about Suzanne. And then I found out Suzanne was doing health coaching, and she's been using the Med Missionary protocol to coach her clients. And you are now both working together, which is amazing. I don't think people understand how amazing it is that when you're doing health coaching to have not only that it's a physician that you're working with, but also that there's two of you. I think there's just such this amazing energy that comes into a relationship when you have more people, especially two people. There's a reason why the Lord sends us out 2 by 2, I think. And so how is it, what happens for people when they start working with you? How is it that you do this?
It sort of happened quite organically, if I can jump in on this side. I think I speak for both of us when I say that it really has been a blessing. I somehow think that it's on both sides. We've both been blessed by the experience of being able to discuss things, because even when you're following a protocol that is well worked out, well set out, there are always small details about every single case that is different. Each and every person's situation requires you to kind of just think, how is this applicable for them, for their specific situation? And being able to discuss things and bounce ideas off each other has been a tremendous blessing. Definitely, I think it goes two ways. So at the moment, some of the clients are people that I tend to meet, either people that are referred to me, and then I kind of let them know that we do coaching together. Sometimes it's people that come from Suzanne's side first. It's sort of been a bit of both, I think.
Yeah, that's also for me a big blessing, because some of these situations are quite difficult, and it would have made me very nervous if I knew I was just on my own. So to be with someone that's also medically knows a lot more than me, and also Dr. Jade has a lot of experience with natural remedies, and she always has the answer or a solution. No, it's really been a blessing. She's very loving, and she's really taught me a lot of things. And
Yeah,
I hope to learn a lot more.
I think that it is such a blessing to work with people who have expertise in a common area, but then you have your own areas of expertise as well. And so when people work with you, will they be getting a consultation with the both of you then at the same time? Is that kind of what happens, or how does it all work?
Well, that's where I'm very grateful for the part that Suzanne can contribute, because she has the patience and is able to kind of do the follow through with all the consultations. Primarily, the consultations are with her, and for the health coaching component, what we have been doing is we set up a WhatsApp group together with both of us and the person who is being coached, so they can share their questions with the both of us on that platform. And then as we share answers with them, at least we don't have to forward messages back and forth. We always know what the other person has recommended, and that's been working really well. But I think we've been very blessed that so far we've been able to kind of work with that system. But if there are very difficult situations where the person would need to discuss things with both of us at the same time, then absolutely yes, I think we will work with consultations that we sign in together.
I see. Okay. So when people sign up to work with you with the health coaching, they are going to be meeting primarily with Suzanne. And then if there are any questions, then she'll ask you about them, consult with you, and this kind of thing.
Yeah,
Yeah, we
and
use
also
the
we've also got an online form that Dr. Jade is, as I said, very good with graphics and putting things, simplifying and putting it online. So the client, they do quite a comprehensive health assessment. So Dr. Jade looks at that before I see the client for the first time. So then me and she talks, and if we need to adapt and bring things in, me and she will communicate. And then also we've got the group where the client communicates, but I can also communicate with her directly because sometimes challenging situations pop up, and then she's very knowledgeable.
Very good. Very good. So if people wanted to get in touch with you, they would go to um, uh, healthrethink.com, or is it .org?
.org. We've got the website healthrethink.org, where my details are on there, but also the details for Suzanne and for the Health and Hope coaching course is on there as well, or the coaching program is on there. And people can also fill out the contact form, which will go directly to Suzanne, and then the rest of the information kind of shares back and forth between both of us.
Okay. Very good. Very good. So the nice thing about it is that with this online platform, you're able to coach people even in different countries. And so I think that's something that people, will find very helpful too.
It's been extremely convenient, and it really has been a blessing to work on the online platform and through the different online modalities. It's possible for me to revise everybody's complete medical history. They can send their results to us. Suzanne and I can share, like on Google Drive, we can share the history and the forms and blood results and all those things. So we're able to collaborate easily in that sense, and stay up to date with the medical side of things. We can revise people's prescriptions and give advice about how maybe as they go through the program and they start having improvement in their symptoms, then I can assist them with adjusting their prescriptions and those sort of things as well. And yeah, the technology has made lots of extra options available.
Okay, very good. But we do want to let people know this is a coaching program, correct? It's still you're helping people, guide people through as they work with their physicians and this type of thing. Am I correct with that?
Absolutely. So we try and work to collaborate and assist them, but it's not a process of them having to switch away from their medical practitioners who have been helping them previously. We take them through the coaching program, give advice as their body is adjusting in the coaching, as they are following the protocol. But we definitely do collaborate and interact as well in some situations with their medical specialists or other professionals that they have been attending.
All right. So how has it been working as far as this coaching program, the Med Missionary protocol, helping people through this? Have you been getting good testimonies?
Yes, I've helped a few people. Even before me and Dr. Jade worked together, put the program together, we were still in contact because I made contact with her. I think initially you did an interview with Dr. Jade. So I made contact with her when I had my first challenging client. And then in that time, she also referred clients to me.
Well,
And
that's
that's found very helpful, yeah.
Yeah. And I think there's something to be said about this. Like Dr. Jade was telling me, she said, I took the course, but, as far as like totally implementing everything, Suzanne has been implementing everything. And, she's the one that knows the ins and outs of the protocol and can work with clients on that. And so I think that, that's something to be said. Like Mercy and I work together, and Mercy knows the ins and outs of a lot of different things that I just help communicate these things to people. And so, yeah, it is really a blessing to be able to work with somebody else who's on the same page and, yeah, can contribute something more than you can too. So
I can reiterate that as well, because when I did the coaching training through the Med Missionary platform with you guys, I wasn't particularly sick, so I didn't really have all that much motivation to implement the protocol to the utmost for myself. And that is really one of the reasons why I feel so comfortable to refer and to work together with Suzanne, because she's been living it, she's been putting it into practice. It's a whole different level of being able to assist somebody else when you've experienced something for yourself, and it really has been a blessing.
Well, good. I hope then people will reach out to you guys. It is at healthrethink.org, healthrethink.org, and you'll find Dr. Jade and Suzanne's contact information. You can be part of their WhatsApp group then. And learn how to work with them on an individual basis as well, I think that'll be a blessing. Thank you both for being here. And thank you for what you're doing. I think that God's going to really bless this ministry.
We are thankful for the training that you've been providing, and also the many, many extra resources that are on the Med Missionary platforms. It's been a tremendous journey for us, a learning journey for me, for sure, and it's been a huge blessing to have access to those extra resources.
Oh, thank you. Thank you for
Thank you so much.
Yeah, thank you.